Hi. Decades ago, they made sugar and seed oils normal, demonized saturated fats, and lied to you that protein damages the kidney. Carbs are essential. Meat rots in the colon. Eggs cause cholesterol, and that safola and dalda are heart healthy oils. They tell you every day that low fat and high carbs, or 6 to 8 meals a day, which comprise of 80% carbs, are balanced diet. And it is told like it's a chapter straight out of the Bible. And if this wasn't enough, they even created a carb heavy upside down joke called the food pyramid to further validate the dangerous dietary advice that promises to land you up in the hospital emergency if you follow it well. In all, it wouldn't be wrong to say that the medical system itself has created the medical emergency. There is a silent pandemic, metabolic pandemic behind the acute emergencies that could have been prevented if metabolic health was paid attention to. If only instead of glucose, fasting insulin was tested, if only triglyceride to HDL ratio was paid attention to, and so much more. Yes, they missed a lot, and you certainly did end up in the emergency one fine day just like that. There's a whole system that has created medical emergencies across decades. So, is emergency medicine just the cleanup cast and crew for the disasters caused by the decades of failed dietary guidelines and pharmaceutical quick fixes? Don't laugh. You have to answer all of this because emergency medicine didn't just evolve, it became necessary only because modern medicine ignored metabolic health until collapse became the only outcome. We'll hear the truth from one such emergency medicine doctor who's sincerely trying to change things at his level, trying to create awareness and draw attention to metabolic health and low carb diet that can actually repopulate hospital emergencies. Hello, namaste, good evening. My name is Ira Sahai. I'm a DLife certified practicing metabolic health consultant, also the chief operating officer of DLife Healthcare Private Limited. A bit of introduction of DLife. It was founded by Anup Singh, an engineer, a silver medalist from India's Ivy League institution, IIT Roorkee. Anup was diagnosed with type 2 diabetes in 2011 and refused to manage sickness. He started writing about low carb, high fat diet on various international forums and gave the template of 100-gram carbs per day max or 20-20-60 in 2012 after having followed it for 1 year himself. The only online mention of 100-gram carbs per day max based on the liver's glycogen holding capacity is Anoop's from 2012. He also made the distinction very clearly, saying that Indian low carb is not the Western keto that made not only low carb but diabetes remission possible for even Indian vegetarians. LCHF pioneered by D-Life in India is now a global benchmark applauded by LCHF stalwarts like Dr. David Unwin, Dr. Gary Fetke and more. Anup also holds the record in India for being a pill-free 15th year diabetic and was decorated with the Icons of India Award in 2022 for his pioneering work in LCHF space. In 2020, DLife launched its diploma course. That's now the only course in this space approved under the Government of India with NSDC partner certification. It's also the number one course in the world with global biggest 144 CPD hours. And now our guest for tonight on the D-Life podcast series is Dr. Ankur Verma from New Delhi, India. Ankur is trained in emergency medicine at George Washington University and is currently a principal consultant and faculty of emergency medicine in New Delhi. He serves as the president of the Delhi chapter of Society of Emergency Medicine India, that is SEMI. Dr. Ankur conceived and coined the term hashtag satisfied, in which SAT are caps. Airway to promote awareness of innovative airway management techniques. He has authored and co-authored more than 40 publications in India and in international journals, along with delivering numerous talks at various conferences. He is the creator and founder of the DESI EM project that many of you must have watched and heard, India's first and the only emergency medicine podcast listened to in over 80 countries. A self-taught nutrition advocate, Dr. Ankur focuses on raising awareness about species specific carnivore lifestyle. He himself turned carnivore, I think, 1.5 years back. And he addresses 2 years back and addresses root causes of chronic non-communicable diseases. Recently has begun integrating emergency medicine with metabolic health research, spearheading studies in this emerging field. I know that Ankur is collecting a lot of data, which I'm really looking forward to. Ankur, welcome.
Thanks so much, Ida. That was quite an introduction. And that was quite an introduction to emergency medicine. Also, you were actually right. Uh, we're like the cleaning crew. And
Yeah.
if you look at the history, I mean, metabolic health actually started to deteriorate like about 50 or 60 years back, if I'm not wrong. And emergency medicine is actually 50 to 60 years old. It wasn't an entity before that. So I'm really looking forward to this conversation. I can see a lot of people joining
Yeah,
in.
Ankur.
So
Yeah, welcome, Ankur. And very important question to begin with. And I think we'll take in as many questions as we can because we have a lot to discuss. You are in working in the emergency. What kind of cases come into the emergency on any regular day in terms of age group, dietary preferences, or the blood markers that you see, the acute conditions that they walk in with? What is the data that you've collected so far saying? And how often do you see metabolic dysfunction at the root cause of emergencies?
yeah, I mean, 95% of my patients are metabolic disorders, right? Dietary preferences was never asked in the emergency department or any other department per se, right? I mean, nobody focuses on nutrition in healthcare because we're not trained to. So, I'm not going to blame the doctors because we were not trained to do that. We were trained to give medications and try and manage a disease. But yeah, most of my patients, so if you look at my daily life, we'll get heart attacks, we'll get strokes, we'll get severe infections in patients who are metabolically broken. We'll get dysrhythmias of the heart, where your heart beats fluctuate from like 110 to 200, 300, whatever. We'll get diabetic ketoacidosis, hypoglycemias, which are complications of diabetes. We'll get chronic kidney disease, acute on chronic kidney disease, where their potassiums and sodiums go up and down, and they come in with life-threatening potassium levels, be it hypokalemia, which is low potassium, or hyperkalemia, which is high potassiums. We see a lot of pancreatitis. We see a lot of gallstones, renal stones, a lot of complications of cancers and the treatment of cancers where patients have undergone radio, chemo, and surgeries, and they're coming in with different complications every day. So these are most of the patients that we see. The only thing that's missing is trauma, right? So like 5% of the cases are trauma, fall from stairs or road traffic accidents, or jumping off the building. So those are some of the traumas that we see. But then if I mean, once I saw the matrix, I realized 95% of the population can actually avoid coming into the emergency department, right? Because when we started doing our research, we started asking all my metabolically ill patients coming in with heart disease, strokes, or diabetic ketoacidosis, or diabetes histories, cancers, Alzheimer's, dementias, all of these, what the dietary preferences were, and they were like, this is like a 32 question questionnaire. And I mean, just broadly, I mean, we've collected more than 10,000 patients till now, and 66% are vegetarians, and the rest are either omnivores or pescatarian, ovo-vegetarian, and they mostly eat egg or meat or fish, like once a week or once a month, which is usually the case in India. And whenever they eat that, they usually have carbs along with that. So I mean, a lot of people proudly tell me that they're non-vegetarian. Oh, I'm a non-vegetarian. I eat a lot of meat. When I ask them how much do you eat, when I ask them how much do you eat out of the 21 meals, if we take out of 1 week, right? 3 days, 3 meals a day. They'll be like, oh, we have it for like 3 or 4 days. I say 3 or 4 days, all 3 meals. No, 3 or 4 days, maybe, once a day, and one of the meals, probably dinner. So out of 21, maximum somebody eats mostly is 3 to 4 meals, right? So that's like 1/5. Uh, that's how protein deficient everybody is. That's how much carbohydrates people are actually eating, being on the standard Indian vegetarian diet, because they don't even know how to control their carbs. They don't understand how much carbs they eat. Another interesting point out of that survey was 46% actually told us they can't quit sugars. They're so addicted to it. 46% of those who actually have added sugar, which is again interesting. And then, I was going through a lot of data about, we know that 17% of the world's diabetics are from India, but Lancet says, and a lot of people actually quote that to me. I just put up a content on that, that only 11% of India has diabetes, which is a joke, right? Uh, and you've seen it in your practice, probably everybody over here who're into metabolic health, and doctors who are looking into metabolic health know that that's not the case. We recently started doing another study, which is really interesting. We're looking at young adults from ages of 20 to 45 who are coming into my emergency for various reasons. and they come in with no apparent history of any past medical history, diseases or comorbid conditions, right? And we're looking at the random sugars. If they have sugars of 140 or above, it could be fasting, it could be postprandial, whatever, it doesn't matter. It's just random blood sugar. We enter them into our study and we run the HbA1c levels. We've collected 83 patients till now who were included, who came in with 140 or above sugars. 46.9% of them turned out to be diabetic. That's almost 1 in 2.
66% you said,
46.
66% you said, Ankur, were vegetarians
That was
of
another
all the
study,
data that,
right? That was another
yeah.
study. Now, again, this is interesting. This is a smaller one because we're looking
Mm,
only at people who are coming in with no past medical history,
mm,
and we're
mm,
diagnosing them with diabetes, right?
mm.
So people who've got young adults, this is between 20 to 45 years old, right? They're coming in with sugars of 140 or above because we check vital signs of all our patients and their HbA1cs, and 46.9% of them, that's 47%, are being diagnosed with diabetes. Who didn't even know they had diabetes, right? They were just walking around with this taking time bomb, right? Kills you silently, right? And again, 60% or 65% of them are actually vegetarians, right? And I just put this up, and this is a really interesting thing. We are going to collect data till next year, December. So you can imagine we'll have thousands and thousands of
Yeah.
patients. Yeah, so that's going
Yeah.
to be interesting. This is just one snippet that I'm giving into this study. We're collecting more data points also. But
Why
yeah,
is
so
this so significant, Ankur? Why is this so significant? Because what are you trying to say? Is there something wrong with primarily a plant-based diet or a grain-based diet like we eat? And
yeah,
what
of
are the
course.
deficiencies commonly found? Because you're looking at a lot of data there. So commonly found with people who are primarily vegetarians in India.
Yeah, the B12 has tanked. I've seen B12 in like double digits.
Mm.
20, 30, 40, 50, 60, with really high homocysteine levels. So B12 is required to break down homocysteine into cysteine and methionine.
Yeah.
And homocysteine actually is a procoagulant. It'll clot blood anywhere in your body. It also destroys your glycocalyx, which produces nitric oxide. So it brings down your nitric oxide also, right? And your glycocalyx is also your strongest anticoagulant. So it keeps your blood flowing. So you're destroying your glycocalyx with that. You're clotting the blood even more. That's like a double-edged sword, right? And this is just B12 I'm talking about, right? Again, hyperglycemia and hyperinsulinemia also destroy your glycocalyx, right? That again leads to inflammation. That again leads to blood clots that can develop into plaques. Infections. So when you have severe infections, they also destroy your glycocalyx. When will you have severe infection? When you're immunocompromised. When are you immunocompromised? When you're mitochondrially and metabolically broken. And when does that happen? When you're giving yourself carbs and sugar spikes and
Mm.
insulin spikes and sugar spikes and insulin spikes. Not just that, obviously smoking and other stressors, sedentary lifestyle, pollutions, all of that also matter, your refined oils and stuff. All of that. And this is significant. This is just B12 I'm talking about. The protein deficient, you know.
But they say dal chawal is complete protein.
No, it's not. Absolutely not. I mean, they've got so many anti-nutrients over there. They've got 3 times the amount of carbs. If they were protein dense, or if they were nutrient dense and protein dense, you will not find fortified dal and chawal in India then, right? They're all fortified. I mean, just research it. They're putting methionine, tryptophan, and arginine to fortify dals. I mean, if dals were such a good source of protein, why would they require fortification, right? Why would rice require fortification? Doesn't help. 3 times the amount of
Yeah,
carbs.
and when you
And you
talk to
and when
these,
I talk about proteins, it's not just about protein as a micro. People don't know we need essential amino acids, the 8 to 10
yes.
essential amino acids in the right forms, in the right availability and biodigestible forms, right? You want it to be absorbed by your body. You don't want to get 1 gram essential amino acid, एक ही कोई मिल रहा है, and then you need to eat 10 different things, and still you don't get it because you're getting so much of carbs. The ICMR came out last year and said this is the food plate that Indians should eat: chawal, dal, rice, lentils, legumes, grains, cereals and grains, and then fruits and vegetables, and then a little bit of eggs and some cheese and maybe a little bit of fish, white meat or lean meat. Tell me who doesn't do that in India?
Correct.
You know so many people who eat exactly the same. My 10,000 patients almost eat entirely the same thing. Mostly eat
Mm.
this. Yes, there is a little bit of junk food involved, where we're looking at the Nova group of processed foods.
Mm.
We're looking at that also. But most of these patients are eating this, especially
घर
in
का
the
खाना.
pediatric. Ghar ka khana. They come and tell me, oh, hum
Correct.
ghar ka normal khana khate hain. Right?
हाँ.
I had a patient who came in yesterday. We had to thrombolize her. Thrombolizing, we had to give her a very strong blood thinner to break the clots in the brain because she came in with a stroke. And I asked the family, what does she eat? She's like, oh, normal vegetarian, healthy food. I said, she's diabetic. She has hypertension. Her kidneys have gone. She's got autoimmune. Now she has a stroke. She's also had a stent put. What's so healthy about your food? I'm talking about a 75 or 80-year-old woman, right? Geriatric age group who eat vegetables and vegetarian diet, a healthy vegetarian diet for many years, right? Grandparents, right? She's 85. She's lived long. But is that how you wanted to live, right? With diabetes and hypertension, with a stroke happening, with a heart attack happening. I'm not talking about longevity here. Even if we're looking at longevity here, it should be healthy longevity, right? Not riddled with disease and hospital visits and drugs and that vicious cycle. So B12 deficient, protein deficient, iron deficiency, major saturated fat deficiencies. Ask patients who have gallstones, gallbladder stones, right? What is gallbladder stones? Your bile acid stasis. It doesn't move, so it collects, it forms stones. Why does it not move? Because you're not taking saturated fats
That's
for it to
correct.
get esterified by the bile acids, right? So it's
Mhm.
not going to be secreted by your gallbladder. So if you ask your patients of gallbladder stones, what do they eat? Most of them would be pure, healthy vegetarian diet, right? Or if they're omnivores, I would call them plant-based omnivores, eating
Mm.
meats once in a
Mm.
while,
Mm.
not too much, right? And this is another research that we are going to start off probably in August or September, where we will be looking at everybody who's coming in with gallstones. We've already got kidney stone research going on with oxalates. We've got frailty with dietary preferences going on, where anybody who's coming in with trivial traumas, breaking their bones above 65 years of age, we're asking them about their exercise routines and regimens and their protein intake and their dietary preferences. We've got a whole metabolic syndrome study going on. We've got a diabetes study going on. We've got a heart attack study going on, where you've seen my data coming in. I mean, the last about 93 heart attacks that we've got, we're about to hit 100 in that. Uh, Everybody's got a high triglyceride to HDL ratio, which no doctor looks at, which no
Correct.
report actually gives you. You need to calculate it yourself, right? Every one of them. Most of them have apparently normal cholesterol, which is lower than 200. A lot of them
Yeah, I
have,
was going to come to this next question, Ankur, which is exactly this. Why do so many patients with a normal lipid profile end up in the emergency with heart attacks and strokes? What are we missing beyond LDL and HDL, the standard isolated
yeah.
markers that people are looking at? Nobody's looking at, TG to HDL ratio or insulin for that matter.
Yeah, LDL and cholesterol are protective. People don't realize that, right? Your brain, cholesterol can't cross the blood-brain barrier. So your brain makes its own cholesterol. So 70% of your brain is made of cholesterol. All your nerves are made of cholesterol. Otherwise, you won't be able to conduct electricity and move around and talk and think. That's not possible. You won't be able to have sex if you don't have enough cholesterol because you will not have testosterone, estrogen, progesterone being produced in healthy levels, right? You won't be able to reproduce. Your endocrine system, your hormonal system would be absolutely disrupted. Your adrenal your adrenal glands, your cortisols, they all require cholesterol as a precursor. Your bile acids, again, to esterify saturated fats, require cholesterol. Every cell membrane is made of cholesterol to maintain its integrity. Did you know insulin receptors require cholesterol for the integrity of those receptors? So if you don't have enough cholesterol, your insulin receptors would be malfunctioning, and you'll end up with diabetes, right? So that is how important cholesterol is. LDL, again, cholesterol doesn't float around in our blood. We all know that, right? It's packed into lipoproteins, right? And those lipoproteins are protective for us. They take not just cholesterol, but triglycerides and other antivirals, proteins, antibacterial properties, all of that to wherever our body actually requires it. And that's really, really important. There are so many functions that LDL does. I mean, even during COVID, lipid profiles were seen, and the lower the LDL and cholesterol levels, the higher was the severity of the disease and the mortality rates, right? And because LDL actually goes and identifies antigens in your blood, viruses and bacteria, covers it up, and signals the rest of the immune system to come and destroy it. And I was talking to Malcolm Kendrick recently on my podcast. He said something really, really important, and even Nader Ali. And both of them said that anything flowing in your blood is a part of your immune function, right? And if LDL was so important for the body, your body will give signals to you if it does not uh, accept those levels. It's like if your sodium goes up 140, 155, 165, you will have symptoms immediately.
Yeah.
If your potassium goes up to 8, 9, you'll die. You'll come in a cardiac arrest. You'll require CPR, you'll require drugs to bring down that potassium level. If it goes too low, you'll have immediate symptoms, right? If your sugar goes really high, you'll have immediate symptoms. If your sugar comes really low, you'll have immediate symptoms. That's why sugar is not flowing in your blood all the time, except for the one through gluconeogenesis, which your body produces. This is 4 grams, 1 teaspoon, right? But whenever you have excess sugar intake or carb intake, it's removed from the bloodstream as soon as possible. So it's not something that the body wants to keep in your blood for a very long time. Again, now I'm talking about the electrolytes. The body tightly monitors that in its homeostatic stages and states, right? It maintains the sodium levels, it maintains the potassium levels, it maintains the calcium levels because those are the important ones. You go up and down in that, you can land up in trouble and into the emergency department. And that happens in who? Who are mitochondrial and metabolically broken, right? That's not happening with the LDLs. If your LDL is going up to 350, I'm not having any symptoms. I'm absolutely fine. Right? My cholesterol is 350 or 400. I'm absolutely fine. So it's just a myth that cholesterol is a problem. Your body, your liver makes 5 grams of cholesterol every day, because it needs to. And if you eat saturated fats, you let your liver rest. So that's not a problem. So, and we all know, I mean, Harvard scientists who were actually paid off by the sugar industry in the 1970s,
Yeah.
$40,000. It's published in JAMA to verify saturated fats instead of sugars as one of the causes of heart disease. Dietary cholesterol is no more a nutrient of concern as published by the American Heart Association in 2019 in their paper. Again, the American Heart Association actually has something called a Prevent calculator, where you can put in your details. It still has cholesterol in it, but LDL has been removed from it, right? So, I mean, yeah, it's a myth. I mean, for people who are watching right now and listening, don't be worried about high cholesterol. Be worried if it's low, because most of my patients who are coming in have low cholesterol. We actually have patients who are on statins. Their cholesterol are very well controlled,
Yeah.
and the cardiologist will be really happy because that's the guideline. This is what it should be. They'll be very happy, and they're coming in with the second or the third heart attacks. Clearly, the medicine
Ankur,
did not help.
in your hospital, have doctors now started looking at insulin and triglyceride to HDL ratio, or are they still
No,
doing the old way?
no, I think some of them are looking at insulin levels. I've had a discussion with with a pediatric endocrinologist where a type 1 diabetic or a type 2 diabetic had come in, but he was like about 18 or 19 years old. And I said, I want to send some fasting insulin. And she was like, yeah, fine, do that. Go ahead. So, I got a C peptide and fasting insulin and some other tests done. So she was okay with that. So, I was happy about the fact that uh, she's happy doing those tests. But not many people actually do that. And we have it available. It's not that it's not available in the
Yeah,
hospital.
correct. Yeah.
We have it available, but we're not testing that,
Yeah.
right? We're
So
still
how do
looking at
they
just the
react to you when
HbA1c.
you're doing all of these, funny things? You're testing insulin, you're looking at
I've got ethics.
triglyceride.
I've got ethics approval, right? So
Okay.
they can't. They can't do much about it. And it's see. I mean, the thing is, nobody wants anything bad for their patients. It's
Hmm.
something that's opening up eyes. I've had discussions with neurologists. I've had discussions with my cardiologists who are actually who are actually accepting. A cardiologist actually came up and told me that your thing on sugars is actually important because every patient of mine has a lot of carbohydrates. So you can imagine that he started to ask his patients what he's eating, right? So it's having an impact, hopefully.
Yeah.
Yeah, so that's something that I'm looking forward to.
Yeah, and while dealing with such patients, Ankur, how often is the homocysteine level overlooked as a cardiovascular risk factor in when you're dealing with emergency situations like these?
All the time. All
All
the
the
time.
time, right?
We know it's a cardiovascular risk factor, but
Yeah,
we don't look into it because the guidelines don't tell us to look into it.
yeah, correct.
If the guidelines tell us to look into it, then we won't be able to prescribe statins, right?
Mm.
Then we'll look into why the homocysteine was high. Then we'll probably check the B12 levels and like, oh, this is the problem, right? Which has actually been documented for many years and which I'm documenting again, right? So I just published a case series on that. Another case series is under review right now for publication. Hopefully it gets accepted. And we're doing so much of research into that. So the heart attack patients I'm talking about, where we are going to hit 100 patients, I think 4 of them have normal homocysteine levels. 96 have high homocysteine levels. And by high, I mean more than double, right? Our average TG to HL ratio is about 3.5 to 4. Average B12 was about 280, which is low, obviously. So yeah, and average cholesterol is 180. Average LDL is about 108. That's not bad. Yet they're having heart attacks. Again, 66% are vegetarians, and 80 out of 100, 84% are non-smokers. For those who want to blame cigarette smoking, 80,
Interesting. Very interesting.
86% are non-smokers. Yeah.
Yeah. So, Ankur, I've seen a lot of your reels and your very educative reels where you've talked a lot about visceral fat as an independent risk factor for metabolic health crisis.
Oh
Tell
yeah.
us, talk a bit about this. I mean, in India, we see it rampantly. So, talk a bit about it. What do you see in your practice?
Yeah, I mean, this is something Dr. Sean O'Mara and Anna are like pioneers and doing amazing stuff on visceral fat. So people don't know that we have like 4 kinds of fat, right? So we have superficial subcutaneous fat, we've got deep subcutaneous fat, we've got fat in the muscles, which is called uh, myosteatosis. And then we've got the visceral fat, which is the most dangerous one. That one, myosteatosis, is basically, I mean, you're fattening up your muscle. So people who eat a lot of carbs and do exercise, their muscles become big. That's fat inside the muscle also, and a little bit of glycogen, obviously. And that's what we do to animals also in factory farming, which I do not approve. Uh, and then you have visceral fat, which is all the carbohydrates is converted into this fat, which goes around your organs, right? And that is one of the number one killers for any disease that you look at. And there are a lot of times where that fat is being collected, and you'll see it all across the country. Anybody who has a pot belly has huge amounts of fat. I mean, yesterday I had somebody we had to put in a chest tube in, and it took about 20 minutes for us to go through all the fat layers to put the tube in. That's all visceral fat because that was around his ribs and his thoracic cavity also. And he had a lot of deep subcutaneous fat, which is also not good. So visceral fat is something that's really, really important. It covers your heart also. So, epicardial adipose tissue. Uh, and we've seen it in a lot of my patients. So we look at a lot of, we don't actually test our patients for it. We look at the coincidental finding of visceral fat because it's not going to be reported by the radiologists anyways. So whenever we get CT or MRIs done for our patients, for whatever reasons that they've come in, after giving them the diagnosis, I'm like, you have a lot of fat inside. It's not going to show up in your blood work right now. You've got lot of fat around your liver, around your kidneys, all around your intestines, around your heart, and then you see it around the neck and the face. Right? So if you have visceral fat around your face and neck, those are the people who actually end up with sleep apnea because your
Yeah.
airway gets blocked by that fat,
Mm.
right? They are the ones who have sleep apnea. If you have visceral fat around your urethra and your bladder, you might have urinary issues or you might have erectile dysfunction, right? That happens. If you have visceral fat around your rectum, you might have bowel incontinence. That can happen. And then if you have it around your organs, obviously you can have dysrhythmias, you can have heart attacks, you can have cardiac arrest, aortic dissection, liver disease, kidney disease, anything can happen. It's not the right fat. It should be as low as possible. The only fat we actually require is superficial subcutaneous fat. That's it. So this is something that we need to look at. So if you do an MRI, and I actually experimented this on my team. I scanned myself. I scanned an omnivore. I scanned a pure vegetarian who doesn't eat junk food. I scanned somebody who eats a lot of junk food. Guess who had the least amount of visceral fat?
The least
It
amount.
was least amount of visceral fat was me, a carnivore.
Carnivore, yeah.
Yeah. And a junk food and vegetarian had almost the same amount of fat, visceral fat
Mm.
inside, because both have a lot of carbohydrates, right? And the omnivore, since there was a meat intake and this, maybe a little younger also, so didn't have as much as the vegetarian and the junk food person, but obviously not close to my carnivore visceral fat abdomen. So yeah, I mean, it's something that one needs to look into. People can get their MRIs done of their abdomen and their and the thorax, and if they want, they can show it to me, and it's very apparent. Uh, if you see it, you'll be like, what the hell is happening with me? If the doctor tells you this is the amount of fat that you have, it needs to go. You need to do your resistance training. You need to eat meat. You need to get eggs. You need to get high quality, bioavailable, biodigestible proteins and saturated fats inside, and you'll see it disappear. There's so many athletes who have heart attacks, this, that, all of that. They have a lot of carbs also. They have a lot of protein, the Gatorade and stuff, electrolyte, sugars. They might look physically fit, but from inside they're getting visceral fat. And Sean O'Mara has actually shown this to a lot of, high performing athletes, elite athletes, where they've had visceral fat around their knees. They've had visceral fats below their six packs or the eight packs or the 10 packs that they, show off. There's visceral fat inside, and they were not actually doing well. Imagine Dwayne Johnson, the Rock, who is like, people follow him for his fitness. He's had gut
Correct.
issues.
Oh.
He had gut issues. He came on Mark Hyman's podcast, and he had
Mm.
gut issues, and he went into his clinic and probably got his diet sorted.
Mm.
He
Just for
because
the
he
benefit of
cheats a lot with pancakes. Yeah.
yeah, okay. So just for the benefit of our vegetarian viewers, can people also develop visceral fat on a normal ghar ka khana? Because
I
obviously, I mean, yeah, they're not taking very high fat, they're eating ghar ka khana.
yeah.
How does that happen?
I think that can happen. I mean, it's not just so. I look at metabolic syndromes as a syndrome, right? It's like it's that big. Anything can happen. It's up to your body what it wants to be suffering with. Does it want diabetes? Does it want hypertension? Does it want aortic dissection? Does it want heart attack? Does it want cancer? Right. So I mean, cancer cells feed on sugars. We know that, and every carbohydrate is broken down into sugar, right? And again, I said carbs are converted into visceral fat also around your liver also, which is your metabolic dysfunction associated steatohepatitis. Sorry, it's a tongue twister for even me. Forget about the layman over here.
Yeah.
So yeah, that's MASH basically. Yeah, steatohepatitis. Yeah. So that happens. But yeah, I mean, it all depends on how much you're eating, and I think DLife is doing some really good work about max 100 grams. I'm absolutely fine with that, but I would still ask people to go as low as possible, 10, 20
Right.
grams, 30 grams. And max 100 grams is for diabetes mostly, I think. Yeah, I mean,
Yeah,
that's
that is the
they're
max
doing,
level. Of
yeah,
course, it has to be tuned down
max level.
according to your
But yeah,
metabolic.
I mean,
Yeah,
I won't know my, I mean, I wouldn't want to comment on the rest of the metabolic syndromes because we're actually getting a lot of people. And obviously, I'm not saying that my patients are having 100 grams. They must be having probably thousands of grams
absolutely.
of
Yeah,
carbs every day in terms
yeah, yeah.
of the dal chawal roti, and we know how addictive chawal is for Indians, right? It's a staple. It takes the taste and flavor of whatever curry you want, and and you can just keep going on and on and on. I used to do that. I mean, my butter chicken would get over, but the gravy is left. Bring on the rice, you know, just rice and
Mm.
curry. Same thing goes with this. So yeah, I mean, won't be able to comment on the rest of the metabolic syndromes right now, but for diabetes, less than 100 grams, yeah.
Yeah. Ankur, what is the role you would say, or how do you understand this? What does sarcopenia and insulin resistance? How do they play a role here?
Sarcopenia, so everybody has, na? After an age, your muscle starts to degrade, right? You need good amount of proteins. First for people who don't
No, but
know
it
what
is very
sarcopenia
relevant
is.
for, say, diabetic patients, especially if they're vegetarians as well. So how do you have any data on this, and how do you see that?
We're working on it. We've actually started working on it where we're actually testing the muscle grip strength. There's a machine that we have. We actually had to
Mm.
procure it, where we're checking their muscle strength for with which We're going to actually diagnose him with sarcopenia, not just the muscle grip strength, but a few other parameters. And we're going to look into that and get their dietary preferences in. We've had, I think we've collected like 10, 20 patients because we're actually looking at elderly age group coming in with trivial trauma. By trivial trauma, I mean, chalte chalte, you hit a table and you fractured your hip. You fell
Right.
down in the bathroom, you fractured your hip, you know, those kind of trivial traumas. And that happens because of sarcopenia, right? Because you don't have enough lean muscle, right? And for lean muscle, you need good amount of essential amino acids. You need resistance training. A lot of people actually just believe in walking. I'm not saying you should not walk, do that, but that's not going to help with your muscle strength. That's not going to help you, once you break a bone. You don't want to be walking around using a walker or a wheel or, using a wheelchair or a walking stick all life. So yeah,
Yeah.
sarcopenia is a big problem in India.
Mm. And why are hypertension? We see it all the time. There is a big narrative against salt. So why are hypertensive patients always advised low salt? That is one. We know the background instead of low carb and sugar, which is really a sugar problem. But then look at when people are admitted into the emergency, when they're taken, in the ambulances, the first thing that they do give is saline. And that's
Yeah,
salt water. So
that's because that
why has this lie been spread against salt?
yeah, that's because I mean we need to do that, otherwise we'll be told or treatment nahi kiya mera kuch bhi. So that happens, yeah. Sometimes it's just placebo, and sometimes it's required because if somebody has low sugars, you need to give the DNS. If somebody has low blood pressure or has been having a lot of dehydration, loose motions, vomiting, we need to give fluids. Saline is just a misnomer. It's called normal saline, but it's actually not normal saline because the osmolarity is higher than the plasma. The strong
Hmm.
iron difference is zero when the strong iron difference of a plasma is about 36 to 38. So it's not actually normal saline. It's actually a hyperosmolar fluid, and that can lead to more acidosis. Anyways, so I'm not going to get into that nitty-gritty.
Hmm.
Uh,
Hmm.
but yeah, I mean, salt as a villain, obviously, some again, like saturated fat had to take the blame. Salt had to take the blame. It wasn't the salt's fault because probably the study showed that whoever had hypertension and some sodium issues and stuff. But what happens, like we know, is when you have a carbohydrate broken down into glucose, has an insulin spike, it activates the RAS system of the kidney, and then it tells the kidney to retain water. Wherever water will go, sodium will go, and then the sodium will increase the blood pressure. Also, in the places where there is already higher blood pressure, like your coronary arteries, your aorta, your carotid arteries, you have higher blood pressures there because they're supplying blood to important organs of the body, and the most vital ones. So they already have. So supposing if your baseline blood pressure in your arm is 90 by 60, your coronaries and your carotid would have probably 110 by 70. Then you have this spike, and that goes to 130 by 80. And then you keep doing it again and again, and break yourself down. You end up with hypertension. Uh, and obviously diabetes. So, that leads to higher blood pressure. Then again, your plaques start to form because of continuous injury to these arteries, right? And that can happen in your periphery arteries also. So, atherosclerosis. Malcolm Kendrick said something really well. Atherosclerosis is actually, we've forgotten that these plaques are actually a diseases of the vessels, not of the heart. These are diseases of the vessels which affect the heart or the brain. But as doctors, we call it heart disease, we call it brain disease. It's actually a disease of the vessels happening
Yeah,
because
but
of
then
what we are
actually,
eating.
it is actually a bad advice, to ask people or to scare people into cutting down salt. I deal with
No,
it
no, no. Yeah,
every
you
day.
shouldn't. Yeah, man.
It's
You shouldn't.
actually
Yeah.
a sugar problem and excessive carbs problem,
Absolute.
which is, yeah. So probably that part in very short, you can probably, for the benefit of those who are, hypertensive and they fear salt, maybe, some clarification there from you
Oh,
would
yeah.
be great.
Those who are scared of it, cut off your carbs, increase your salt, see the magic happening, and then come back to Ira after that. And you can show her the results. You'll see the difference once you've cut off carbs and you've added salt into your diet. I mean, Ira went through a lot during her sickness, right? And she had the guts to ask her doctor, "Is salt causing my problem?" And they said,
Correct.
"We don't know. Is protein causing my problem? We don't know." I think recently some doctor came out and said nephrologists are going to have a field day because of these protein crazy people who are on social media and stuff. And we'll have nephrology units being filled in with kidney disease because of the high protein intake. Shashi had actually shared that with me. And I'm like, come to my nephrology department. I will show you how busy they are already dialyzing patients who have
Mm,
spoiled their kidneys because of their carbohydrate intake. And diabetes and hypertension are the leading causes
correct.
of kidney disease. And diabetes and hypertension happen because of what you're eating, right?
Mm,
And you're eating carbohydrates. That's what's causing your diabetes and your hypertension. And this has been documented in 600 BC, man. Come on. Uh, and even in the first textbook of internal medicine by Sir William Osler, right? Knighted. Great man, probably, yeah. I don't know him, but yeah, I've read his books. Uh, and it's all been documented. So where was I? Kidney disease, yeah. So you've got all the dialysis units are full. You've got patients waiting to get dialyzed. You have kidney transplants happening every day in every hospital. Why is that happening? Because of the protein intake? No, it's because of your carbohydrate intake, which has led you to diabetes and hypertension, and then chronic kidney disease one, and then you were put on medication in the two, stage three, stage four, stage five, and end stage renal disease,
correct.
and then you need
Correct.
to be dialyzed, right? And none of them eat proteins, by the way. They're all leaking proteins, yes, because your kidney is going to excrete protein once it's damaged, right? And you can still reverse the damage by eating the right proteins and fats and removing the carbohydrates. Liver transplants happening every day. 65% of the liver transplants are happening to non-alcoholic fatty liver disease, metabolic dysfunction associated steatohepatitis, MASH, right? Not to alcoholic liver disease, but non-alcoholic liver disease. I mean, come on, give me a break, man. If some doctor saying this, that protein is going to lead to a nephrology epidemic in the next 10 years, all the best to him.
Ankur, do you get a chance to talk to your patients after they have settled down and kind of, walking out of the emergency about the diet part? And how do you ensure, that they understand and they follow? Is there any follow-up kind of a regime with them?
So it's not just me talking. I see a lot of my teammates have actually logged in to see this. So they're all doing a great job in collecting the data and
Yes.
actually counseling the patients that they're also seeing. I mean, they're asking them the right questions and they're guiding them. They share my Instagram, they share my podcast and all of. It's not very easy to get all of them to follow because they're going through a lot. But we do try and plant a seed. We can't force them. We've had a few who've actually come back to us and are following. I'm in touch with some of them, and they're trying to follow an animal-based or a carnivore diet as much as possible. But yeah, my teammates, even if they might not be following a carnivore diet, I know some of them over here, they must be laughing because I'm going to pick on them. They do have carbohydrates and they do like their cakes, but they give the right information to the patient now. They're actually asking what
Yeah,
they're
yeah. I
eating
think
and
that's
not
very
eating. Yeah.
important because what after, emergency, I mean, you go back to eating the same way. I mean, you land up back in the emergency again, as you said, coming back with heart attacks and stuff like that. So,
Oh yeah, yeah.
yeah,
That's happening. That's happening a lot. A lot.
yeah. But I'm sure there must be a lot of people who are not willing to change their dietary preferences, Uncle.
Yeah, I've
So
had a
we are talking
few
about
say, oh
India
yeah,
here.
I've had a few who told me that mar jayenge par nahi khayenge. All right.
Correct.
So a lot of people actually think that, the moral issue, religious issues that, killing animals is that. Has anybody seen what aluminum phosphide does? That is a pesticide and a rodenticide used for protecting your grains and cereals that you're eating. We get patients who ingest this aluminum phosphide by mistake, or sometimes, consume it because they want to die, because they've had a breakup or something, and they die. They come in walking, talking. In 1 hour, they're dead. 100% fatality. I have saved just one patient out of hundreds and thousands of aluminum phosphide poisoning that I've seen. This tablet, once it goes in, converts into phosgene gas and destroys your cardiovascular system. That's what you guys do to all the rats and rabbits and other rodents and pests that want to eat your food. You're killing them intentionally. So, do not come after me with the moral bandwagon. I see what it does. I've seen it. And a lot of doctors over here who work in the emergency have seen what it does. right? So if you're telling me कि हम जानवर मार के नहीं खा सकते हैं खाना, sorry, no diet is bloodless. And if you don't believe in evolution, we are the apex predators.
Predators, correct. Hmm.
We're killing our
Ankur,
own by actually feeding them herbicides and pesticides.
yeah. Yeah. Ankur, to people who are listening to this podcast, people who are walking into emergency in the in the early 30s, mid 30s, when should one become aware? What are the markers that one should become aware? Or, what can one do to prevent getting into such a situation? We are seeing heart attacks with, very young people these days. So, such cases, I mean, what is the correct way going forward coming from an emergency medicine doctor?
Yeah, I think once you hit 30, you've got to get tested. Because 30 years of eating bad is going to take a toll, right? So, you need to get your fasting, insulin done, your homocysteine levels, B12, vitamin D, all your micronutrients, iron. Then you get your hormones, thyroid profile, get free testosterone, estrogen, progesterone done, the free ones, because that's the more important one. That's the one that's actually available. That's the one that's actually going to help, not the ones which are actually stuck to your hormones. Uh, I mean the receptors. Uh, get those done. Lipid profiles, yes. You want your cholesterol as high as possible, LDL as high as possible, HDL as high as possible, triglyceride as low as possible. Get your routine biochemistries, your liver functions, your renal functions, your CBCs. I also go for C peptides, cystatin C. Uh, and what else? Scans. Get a fibroscan of the liver done. Get your CT angiography done, which also gives you your CAC scores. Probably at 30, you don't want a full-blown CT angio. If you really want to, you can, but you can check out your calcium scores. And I suggest get an MRI of the abdomen done and show it to us. We'll show you your visceral fat. If you have these comprehensive tests, am I missing out something? I think this should be enough. And B12,
Yeah.
D3, all of that is there.
Yeah.
ESR, HSCRP for I also suggest don't just get your TSH done, get your whole thyroid profile with free T3, free T4, and anti-TPO and anti-TG, because a lot of Indians have
Correct.
Hashimoto's. A lot of Indians have
And
Hashimoto's. My
misdiagnosed. Every
God, yes,
second
yes,
case.
yes. Yeah, yeah,
Correct.
yeah.
Every second
And,
case.
and it's
And
not
not
that
only
difficult to
that,
reverse it.
diabetes, type 2 diabetes, people have been being treated as type 2 diabetic when they have not even tested GAD65, GAD65, and they found out that they were LADA, actually.
Yeah, 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 yeah. So I mean, yeah, I mean,
So,
there's a lot of issues happening. Yeah.
yeah. So I think that's a great input there, and we'll go with some short myth busting questions that I think our audiences will be very
Ooh, I
interested
love
in.
this.
Yeah, so I have to do it with you because it was great the last time that we did an MHC. So,
Yeah.
Ankur, somebody who has had a heart attack or a cardiac event, doctors, all the doctors that I've heard, I'm not talking about doctors like you, but everybody, right from, watching a reel to TV to newspaper to, local clinics, everybody, the first thing that they tell them is don't eat meat, don't eat ghee, don't eat eggs, don't eat, any of these. This is a terrible advice as it is, but I want
Yeah.
the doctor to talk about this. What would you suggest a patient who's had a cardiac event? What's the way going forward in terms of diet?
It's sad that they get this advice because they were not eating this even before their heart attack, right? So they should know that this is not the cause of your heart attack. Ask your doctor what caused my heart attack. Should I avoid that? Is it the meat which caused my heart attack? Is it the egg which caused the heart attack, which I don't even eat? These were non-existent in my diet. Why are you telling me not to eat it? Right? Don't be afraid of it. Eat that. It's actually going to be protective for you. Remove the carbs. That's what caused your heart attack. So go ahead with that and eat that.
So besides the Monday nahi khayenge, Tuesday nahi khayenge wala, the crowd, a lot of people, they will spam you everywhere and even in your life, around. My grandparents were very healthy. They lived up to, 90, 95 and they ate a vegetarian diet. What is
Yeah.
it that is not working right now? I mean, how would you counter that argument?
So, like I said in the start, it's not about longevity, right? I mean, I had grandparents too who lived up to 90s. They suffered from different metabolic disorders and they were all vegetarians, right? I mean, they had diabetes, they had kidney disease, seizures, frailty. But so, we can't be sure. So a lot of people actually think that the grandparents were healthy, and I'm sure they must have been. I'm not saying that they may not have been, but a lot of people actually don't know the whole spectrum of metabolic disorders, right? They don't know about depression, about schizophrenia, bipolars, anxieties, gout, arthritis, hypothyroidism, diabetes, hypertension. Right? They think diabetes and hypertension are the
But
only
it is
two
also about the quality of
only two
life, I think,
diseases. That's
Ankur.
what I'm
It is
saying. Yeah,
also,
I'm coming to that
yeah,
only.
yeah.
Yeah. So,
How often, I mean, I don't remember, my grandparents probably, running with me or, doing much activity. In
that's
fact,
what
my
frailty,
my
right? Yeah,
granddad
yeah,
had
yeah.
7 fractures. So, come to think of it, the quality of life, I don't think that was as good.
Absolutely.
And
That's what I'm talking about. None of my grandparents actually ran around with me, right?
yeah,
And they had broken bones, and like I
correct.
said, diabetes, and then the complication of diabetes, multiple admissions, iron deficiency, all of that happened, right? Most of the people who actually claim this are only looking at till what age did they live, right?
Mm,
There must be some exceptions. I'm not saying that there may not be. There must be, obviously, because they didn't have so much of pesticides then and all of that, whatever. But even in those days, probably if you look at my great grandparents, I don't know much about them till whatever life till age they lived. People actually did die, right? We don't know what they died of. We don't know if they died of old age or a heart attack because you couldn't diagnose a heart attack at that time. We don't know if they died of diabetic ketoacidosis or a stroke because people didn't know what that was or they were not able to diagnose it, right? So, can't be sure. I mean, for me, it's a little ambiguous. I've seen a lot of people who are actually doing really, really well. I've seen way more people who did not do too well, and it's not it's like it's not a conversation starter for me. I just ended there and then. Like, I've seen the other side also, and I'm not talking about just living a long life. I'm talking about dying as late as possible, but as young as possible. That's what the aim is.
yeah.
That's what we need to do. We need to be as healthy as possible, even when the time we die of natural causes.
Mm. So, what would you say to this advice of not eating more than 2 eggs a day, and two of them, or maybe 3 eggs a day, two of them should be only egg whites, one of them should be egg yolk. So,
Yeah,
a
I don't know.
lot of people, yeah, a lot of
Yeah, I don't know
people
where it's
that I
come
meet,
out from. Yeah, I mean, I think this is
correct.
just whims and fancies of people. I eat 6 eggs a day minimum. Yeah.
Eggs
So
cause cholesterol.
yeah, of course, eggs has cholesterol in it, and it will lead to higher cholesterol, and you need that. But again, it's not going to lead to, you'll need to eat 25 to 30 eggs a day to get 5 grams of cholesterol that your liver makes, and you're not going to eat that anyways. But all the micronutrients in the right amount is in the egg yolk, and even the albumin, the protein that is there in the white is only going to help you if you have the fat along with it. That's why nature made the fat with protein. If you look at all the proteins, it comes with fat. You're supposed to eat it with that. And your B vitamins, your fat soluble vitamins A, D, E, and K2, all of that is available in the yolk. Your heme iron, taurine, choline, carnosine, carnitine, all of these are there in the egg yolk. You need it. Even
Yeah.
vitamin C.
Yeah, so and so the why are doctors, scaring people all the time about, you see all of these Instagram reels, every doctor. I mean, I wish they were more like you, but what can be done? I mean, this is, and coming from doctors, when people, send us those reels, doctor is saying, and that is such a nuisance really for
Spread the
us.
truth.
Yeah.
We need to
So
spread the truth. Yeah, I mean, there's been a lot. I mean, I don't know. I was never against eggs, even as a doctor. But yeah, I mean, it's just myths and propagandas, right? And uh, like I said, we've not been trained. But yeah, that doesn't take away the fact that we've got a thought disorder and we don't want to unlearn and relearn. That's a big problem with doctors that I see. And nothing against them. No offense to anyone. If you do take offense, I can't help it. But yeah, we do have a thought disorder. We've taken it on our egos that I mean, once we've read our textbooks, once we've treated patients, we know what we know, right? And there can be no other way, which is not right because we're not doing anything for the patients. We're not actually saving lives. We're not curing anybody. No doctor can proudly tell me that they're happy that their OPD footfalls have fallen down because they have cured patients and reversed their diseases, and they do not need to come back to their OPDs again because they're reversed their syndromes and they're cured. Not a single doctor can say that. None, except a few. Then what are
So
we doing
what
as
would you,
doctors? Yeah.
what would you say to, the larger population of this country, Ankur, given that, most people do not want to change their dietary preference, maybe add eggs. I know you will say carnivore, and that's what I
Animal
will
based,
advocate.
at least as
Yes.
close to animal
So
based as
how
possible.
can,
Yeah.
probably optimize the diet or the dietary preferences that they have?
Go for eggs. Eat as many eggs as possible. Some people can do some whey. You can make whey at home also from milk, or you can do look for a good source of whey which is unflavored. You don't want naturally added, and I mean, what do you call them? Natural flavors and all that. Don't do that. But yeah, and you try and get in. I mean, people say 0.8 gram per kg, but that's too less. पर उतना भी नहीं मिलता लोगों को, उतना भी नहीं खाते हैं. But yeah, try and hit 0.8 grams per kg of essential amino acids, please. Not just any random protein from sattu and dal and sambar and stuff. Yeah, and pea protein and soya.
It's still a
Soya is the
shocker that,
worst.
a lot of people say it's still a shocker that dal is not protein. And we are done, explaining
अरे
that.
उनको बोलो गूगल करके देख ले, सब सब उतने में ही पता चल जाएगा.
But there are so many celebrity dietitians, saying dal chawal is complete protein.
Well, there are
I could
celebrity
bang Instagram
dietitians.
on my head.
There are celebrity dietitians and fitness influencers who are actually prescribing vitamin C IV injections for anti-aging.
Correct.
They don't know that you're bypassing the gastric system and converting vitamin C into oxalates right there in your blood in thousands of milligrams, which is going to destroy your glycocalyx, which is going to destroy your systems. It's going to lead to so many clots in your body. You have no idea. And somebody actually died of that.
Hmm. So what do you call those people who call low carb, ketogenic, and carnivore diet a fad? It still goes on
It's a
and on and on.
lifestyle. It's not a fad. It's not a diet. It's
Yeah,
a lifestyle. There you go.
yeah,
Let them
correct.
say what they want to say. It's a lifestyle. Yeah. This is how we're
Hmm.
going to live.
So do you agree that the official dietary guidelines
Should be
actually
changed.
promote metabolic
Oh,
diseases?
yeah, of course. Yeah. Yeah. It's not doing anything
Should
to help
people
it,
listen
right?
to,
I mean,
should,
the like I told you, the ICMR food plate
yeah,
is what everybody's actually eating and they're yet diseased, right? So, and if you're still promoting that, then I don't want to use strong words.
yeah, and people are still believing in it. And it's a toppled pyramid, actually.
Yeah, yeah, absolutely, yeah.
Ankur, what is that one medical practice in emergency medicine that you want changed or you wish would change?
Emergency medicine practice. Oh, there are lots. But yeah, I mean, I just wish people look into. So I had a very interesting incident today. I mean, not an incident, but somebody messaged me on Instagram. He's a doctor in Bangalore who said, I had a heart attack patient, and and he told me very proudly he's a non-smoker, non-alcoholic, and pure vegetarian. And then he got into his diet, and he was pure vegetarian. Does not eat any this. Heart attack. He checked his B12 levels, which was like 120. He checked his homocysteine level, which was 30. And he spoke to his HOD. We need to do this more regularly and actually educate our patients regarding eating meats and not telling us pure vegetarian as if eating meat is a sin and it's going to cause disease when this is what is causing disease. I was like, fantastic. Somebody is actually waking up, right?
Yeah.
The seed has been planted, right? And if he does it in his own hospital in Bangalore, it's a very big hospital, you know, it can change, right? So I want emergency physicians to look at the matrix where we are treating maximum metabolic disorders patients, ask them what they're eating, guide them towards the root cause because nobody else is going to do that. Emergency medicine is the biggest advocate for the patients. Nobody else.
Correct.
You don't have insurance, हमारे पास आ जाओ, हमें ट्रीट करना ही है. आपके पास पैसा नहीं, आप इमरजेंसी आ जाओ, हम आपको रिफ्यूज नहीं करेंगे. We will save your lives anyways. We will do whatever is required for you, right? You don't have money, you can't go to an OPD. You can't give a doctor's consult, but you can come for an emergency treatment, right? And we provide that. We don't refuse anybody, right? A lot of other specialties can actually refuse. I mean, if you don't have insurance and stuff, right? Especially around the world where you have doctors tied up with insurance companies, that's a different thing altogether. But I mean, emergency medicine are the biggest advocates for their patients. So we're the only ones who are actually going to talk about uh, what the root cause is. So I want emergency physicians to actually understand that we're saving lives in that moment of time, but not later on, right? Only in that moment of time, not later on. we're actually not saving lives at all, because they're going to come back and be put back into society, into the vicious cycle of disease, drug, and hospitalization and bad diet. So they
One
will
small
end up
question on
getting worse.
yeah, one small question on fatty liver. We've already talked about it, but every day, and I'm talking about a 17-year-old kid. I just had as a client, and we reversed grade 2 fatty liver in 60 days. But the misinformation and the bad advice given to her was don't eat fat, don't eat meat, don't eat eggs. So basically, they went and told that, they are with me, and they were scared to, to the last point possible, that it's not going to work. And what was funny was, Ankur, that she was given vitamin E, as a solution to fatty liver, which is just an antioxidant. I don't know what vitamin E would do, in a fatty liver grade 2.
You've already
So,
got your antioxidants in your body, right?
yeah. So what would you advise to people who are, and I think 1/3 of India is walking around with fatty liver. So what would you advise to people who have been diagnosed with fatty liver? Should they cut down on fat? Should they cut down on eggs, meat? What is it?
Carbs. We've already spoken about that. You need to cut off your carbs. That is what is getting converted into fat. I mean, there's no question about it. You can ask your chat GPT also, those who have questions, those who are confused when they get diagnosed with non-alcoholic fatty liver. Just ask, what converts into fat which causes non-alcoholic fatty liver? And you'll get your answer. And then you go to D-Life and you go to ERA and get fixed up.
Yeah. So I think we've come to the end of it. One last message to, doctors, especially young doctors, and also to those who say that, diabetes and other metabolic syndromes cannot be reversed on a low carb or a dietary intervention. What would you say to them?
It's funny, nobody has actually come up and told me that you can't reverse this
Mm.
through diet and nutrition. But yeah, on other social media platforms, I've seen people actually say that. Uh, I mean, if you've not tried it, you've not done it, right? So those who have doubts that this can't reverse disorders, give it a shot. You're not doing a good job anyways, right? Of treating and curing somebody, right? You're just managing disease like healthcare managers, and trying to make people live on a ventilator for the rest of their life, right? And by ventilator, I mean medications and bad diet.
Correct.
Uh, that's not what we became doctors for. For the young ones out there, ask your professors, ask your teachers, start asking questions. Don't just follow what they're saying because, they've been taught the same, right? Ask questions. Why did this patient of ours have a heart attack or a stroke? Or, when diabetes is caused by excess of sugars, why don't we just cut off his sugars and probably the patient won't require medications. Start asking those questions. I mean, as the young lot out there, you guys can change practice. I mean, we've got age-based practitioners who are very old. It's not easy for them to change their practice. It's not going to happen. They've got families, generations coming to them for advice, and they've been giving the same advice all throughout. Very rarely do you see any of them change, but this is the time that you can, mold yourself into a better doctor. I think that should be my last message to them.
Yeah, and learn nutrition, please.
Yeah, of
Because,
course.
yeah, I mean, I always appreciate, and I'm so in awe of the doctors at D Life, who chose against the, tide, because nobody talks about nutrition. And these are the doctors who chose to go against the tide. They learned a lot. And now, the outcomes they're getting are fantastic.
Yeah,
So, of
absolutely.
course, that goes without saying that nutrition now needs to be part of, the medical protocol as well, because it is not ethical to be medicating people for the rest of their lives if something can be reversed through a lifestyle or a dietary change. Anything
100%.
to,
100%. Yeah, they need to learn nutrition and then follow it themselves. Not
yeah.
just preach, but practice what they preach.
Mm.
Walk the talk. Do that. And
Yes.
I mean, belated happy Doctors Day to a lot of the doctors who might be online, but you can only take care of your patients if you are healthy enough. They need to get motivated by looking at you. So, I mean, if you have a fit doctor who knows this thing or her thing, the patient will actually, listen to you. So, go ahead and do that. I mean, and Shashi and I have spoken about this on my podcast, how
Yeah.
unfit doctors are in
Obesity
India,
among
right? Yeah.
doctors. Yeah.
Yeah. Obesity, mental disorders, hypertension, diabetes, fatty livers, uh, visceral fat, though, comes first.
So I think with this, I come to the end of the D Life podcast series. I had a great time chatting with Dr. Ankur Verma, who's trying to change a lot of things in the emergency medicine space around him. He's making people aware. He's making people, educating people about low carb, ketogenic, and carnivore diets and the root cause of why they landed there in the first place. So, Ankur, thank you so much for coming and speaking to us on this D Life podcast series.
Thank you so much,
Anything that,
Ira. Yeah,
yeah.
it's been an absolute pleasure. And I always have fun having conversations with you all.
Yeah, we'll have more of this because there's so many questions that we would, that are left undiscussed. So probably we'll have another one.
Oh, yeah.
But anything that Anup and Shashi and all of you would want to come and say to Ankur?
Hello, Doc.
Hi, hi, Shashi.
I
I,
thank you very much.
one encouraging input, real data. 85% of metabolically ill or the cases that he saw were non-smokers.
Yeah.
Yes, that's what I said. Very interesting.
Thank you, and I think your conversations are always enlightening, and especially I keep seeing your reels on homocysteine level, which seems to be
Yeah.
terrible in most cases, and we commonly see in almost all the clients the absolute low level of B12, homocysteine, and
Yeah,
even tanked level of testosterone in men.
yeah,
Huge issue.
absolutely. Yeah.
In
It's a
fact,
big issue. I
today,
mean,
in
yeah.
fact, today I saw a 13-year-old kid with 100 fasting insulin.
What?
Yeah.
100.
Junk food.
Mhm.
And mother tells I'm helpless. I cannot do anything.
Yeah, another aim of mine is to actually get into schools because these schools have made it mandatory for everybody to have vegetarian food only and nothing else, and they're all using seed oils and refined
We
oils.
talked about it in
Yeah,
MHC also, Ankur,
yeah,
and
yeah,
there's a lot of khichdi in all these Anganwadi schools.
yeah.
So they've replaced eggs completely. They've taken off milk. Probably they are giving diluted milk or something. But
Millets.
khichdi is now staple instead of anything else. So that's
Yeah,
that's
that's
so
sad.
sad to know.
Yeah, yeah. That's only going to cause more disease when
Yeah.
they grow up. Yeah. Emergency medicine will that's when the nephrology clinics are going to thrive 10 years from now.
Mm. So I think we can now thank you so much,
Thank you.
everybody. Thank you for turning up and listening to this wonderful podcast with Ankur. I had great fun, as always, talking to him, and we'll get together again and chat some more. Thank you, Anup. Thank you, Shashi. I think we can just turn off the recording and then take a screenshot probably of all.